Well, hello, everybody. I'm Shannon O'Kelley, physical therapist, and he is Dr. Chris Hawkins, orthopedic surgeon, sports medicine specialist, and welcome to our weekly podcast. Our podcast is called Start or Sit. What we do on this podcast is we talk about the previous injuries. That would be the injuries that happened on week 9. Now we're looking for the up-and-coming week 10 games. And are these players going to be able to play in your fantasy football league? Are they going to start, or are they going to have to sit based on their injuries? So we'll talk about some players and their injuries. And Dr. Hawkins, you've done a great job. You always do a fabulous job. When I get off these podcasts, I always learn something from you. So I appreciate all your energy, your intelligence, and your experience in sports medicine and players and returning to activity. Are you ready to go?
Absolutely, Shannon. Sounds great.
All right, here we go. T.J. Hockenson, tight end, Minnesota Vikings. Boy, Vikings, they lost Chris Cousins last week or the week before to an Achilles tendon. Brought in Dobbs. Dobbs was there for 5 days, and he won a big game. But he won a big game because he's got great receivers, and he's got a great tight end. And T.J. Hockenson, leading receiver for the Minnesota Vikings, he's got some rib injuries, limited participation in practice this week, I hear. Pretty painful injury. What do you think? Start or sit for T.J. Hockenson, Minnesota Vikings tight end?
The good news for him is it looks like this is one of those cartilage-based injuries with his ribs. It doesn't appear that he had an actual fracture. And we've discussed in the past how it's a painful injury, but given his history, he's a tough tight end out of the University of Iowa, and he will be playing this week. They're just resting him during the week to essentially allow him to allow that soft tissue to start to heal up. I'm sure the defenders will be doing their best to land hard on it and try to make him have to leave the game. But I think he'll be a play for the game, and I would expect to keep him on your team.
Yeah, so you think he's going to play and shouldn't be affected. Yeah, you mentioned, and you're exactly right. I couldn't agree more with you. Rib injury, cartilage, it still is painful. It's hard to protect if he does take a hit. Could be challenging, but he's a play for this week 10. Is that what you're thinking?
Yep, I think he's a definite play.
Yeah, that's kind of interesting. You mentioned, let me tell you, University of Iowa. You talk about that is tight end university. I mean, can you mention and name? I mean, there's multiple tight ends in the NFL that went to the University of Iowa, and Hockenson is one of them. Who's the other big name one? Do you know?
Well, you've got Kittle went there.
Yes, that's right.
Noah Fant is from there as well.
Yes, that's right. That's right. Just want to.
I believe Sam Laporta as well, who's the Detroit guy, is also in Iowa.
Well, now you're getting out of my scope of intellect here. So good work on that. It's amazing. Have you noticed this year in the NFL? What I've noticed, the tight ends are playing a huge part in the passing game, a lot more than I think I remember them playing. And Hockenson, I believe, is he the highest paid tight end in the NFL? Did he just get a big contract with the Vikings?
Yeah, I think you're correct. I think he may have just jumped up to the top. And, it used to be there were only one or two guys that played like this as tight ends, but now you're seeing that almost every team has a guy who's athletic, who can high point the ball and has good hands.
They do have great hands. Another tight end here, since we're talking about tight ends, let's keep that tight end theme going. This is Dallas Goedert. He is a Philadelphia Eagles tight end, well known, fractured forearm. Boy, I tell you what, he is undergoing an MRI on Monday, checking on damage. But I mean, how does a guy play with a fractured forearm? What do you think? Start or sit?
He's going to be a sit. The good news is it appears he's an isolated ulna fracture. So when you injure your forearm, it's kind of like a chicken wing. You've got two bones there. And so the ulna is the more subcutaneous, the palpable one that's on sort of the backside of your forearm. And the radius is the one that allows you to rotate. And so when you have these isolated, they used to call it a nightstick fracture, meaning like when you put your arm up and the policeman wanted to hit you, he could break it. So anyway, that is a big thick bone. It's very amenable to getting fixed, and so they can put a plate and screws on it to let it start to heal. and but that'll put him out. He'll probably be at least 4 weeks on IR.
Yep.
But ideally, they can brace something like that. If it's healing well between the plate and screws being on there and a brace, he can probably be back doing some football activities in 4 weeks. But he'll definitely be a sit for right now. But I'd keep him on your team.
Keep him on your team. But I had read automatically if a player is going to be out for 4 weeks, they go on injured reserve, which is a mandatory 4 week out. Is that did I read that correctly? Injured reserve is 4 weeks.
Yep, exactly. So that's why it'll be a minimum of 4. And I think legitimately he'll probably return to play in 6 weeks. So he'll definitely be a sit for this week. And I think the MRI was really just, again, because there's those 2 bones in the forearm, usually you want to see, has there been any injury to the soft tissue that helps hold them together really at the wrist level? And so that's usually what the MRI is helpful for.
Yeah. Okay, there you go. The next player we have is a wide receiver again. We're talking about, let's see, Christian Watson, Green Bay Packers. It looks like he's got a back and chest. I think I might have seen this. He had this acrobatic catch and he landed awkward, and I think he's got contusion in his back, chest, just a lot of soft tissue injury. He's got limited practice this week. Again, a receiver going up for the ball, getting hit again. I don't know. Start or sit. What do you think?
Yeah, I think he's going to be a start for this game. I think the concern is again, and this is where it's not as much about his injury, it's just about his role so far this year and how the Packers are playing and how Jordan Love is as a quarterback. I think he would be somebody I'd be reluctant to actually play him on my team, but I do believe he will go into the game and they'll try to get some meaningful yardage out of him.
Yeah. Okay. So he's a start, maybe limited activity, might not produce a lot for your fantasy football team. He is going to start, but again, just kind of keep an eye on him. Dameon Pierce, running back, Houston Texans. Houston Texans seem like they've kind of caught their wind, so to speak. I think they've actually got a couple wins back-to-back, if I remember right. But they have the Buccaneers this Sunday. Pierce has an ankle, and I believe it's a significant enough injury. He is ruled out for this game, Week 10, Sunday against the Buccaneers. Is that what you're hearing too?
Yes, exactly. They've been a little mum on the degree of his ankle injury, but as we've discussed in the past, usually when these things start to stretch out, it's starting to get into that high ankle area where it's going to take time to let it rest, to allow him to be able to push off. We all remember, like at the beginning of this season, how many games Austin Eckler missed for the Chargers, and Saquon Barkley as well, with these ankle sprains that turned into a week-to-week thing. So it does appear that they have ruled him out for this week. So obviously he's a sit. And the expectation, I think, is that this may turn into a multiple-week issue with it being a high ankle sprain. And just like you said, Shannon, they've done pretty well. C.J. Stroud has really come along as a quarterback for them and really producing. And so that's actually probably taken a little pressure off of that running game for them.
Yeah, C.J. Stroud, I think last weekend he broke a record or something like that for passing yards with the Texans. I thought I read something.
He had 5 touchdowns, I believe.
Yeah, just amazing. It's always interesting as the season progresses. You look at these teams that start out the first 5 or 6 games not so good, but then they get it together and they finish strong. And the NFL, here we go. It's a 16-week season, and we're looking at week 10. So we're going to start seeing some changes here. And as we look at these injuries, I think one of the things we need to assess, and you do a great job with this, is where is that team at? What is that player's role on that team? And is that injury, because they're not their team maybe that's not performing, or they're going to sit them and rest them so they're good for longevity next season. And here's a gentleman, Indianapolis Colts. I'm not sure they're having a great season. They lost Richardson, their quarterback. I think he's got a grade 3 AC separation. Gardner Minshew, go Cougs, is in the backup role. Running back here, wide receiver Josh Downs, Indianapolis Colts, knee injury. He left the first half of the last week's game with a knee injury. Don't know what's going on here.
Yeah, so it's come out that he's dealing with a low-grade MCL sprain. So it's kind of one of those injuries that, if you can put up with the discomfort, it's manageable. A lot of linemen will play games the whole season with a large supportive brace on their knee and just sort of play through it if they can. He's obviously a skill player. Wearing a heavy brace is going to compromise his ability to twist and pivot. So he'll be somebody who's probably going to be, they'll warm him up and see how he looks. But I think I would sit him for this week. I think he is not going to be able to be a full player, he won't be able to go full speed in the game. So he may see action in the game, but from a fantasy perspective, with an MCL injury at his position, I would sit him this week.
Josh Downs, wide receiver, Indianapolis Colts, is a sit for your fantasy football team. Here's a big name wide receiver. Boy, we got a lot of wide receivers and running backs. They do take the blunt of the contact. Jamar Chase, Cincinnati Bengals, Monday night. I did see this one, definitely. He went up and he came down on his back, and it was interesting as Chris Collinsworth, who calls Monday Night Football with Mike Tirico, Chris being a retired receiver himself, the first thing he said, oh my gosh, he is going to have a hard time getting out of bed tomorrow. I'm telling you right now, that is a back pain and injury there. So I think he is questionable for Week 10. He's looked pretty tender.
Yeah, he's obviously got lucky and didn't have any structural damage to his back. Like you said, he was able to get up, and he did actually play some more in that game. But that's the next day when you feel like you got run over by a bus. The traditional old school plan for a guy like him would be work him through the week and then probably have him on some anti-inflammatories, possibly like an injection of Toradol at the end of the week, and see if he could go full speed in practice. In this day and age, we're being a little more cognizant of the long-term implications of that. So I think he's going to be somebody who is going to be a slow return back to play after that big of an injury. So he can be dynamic, and they are turning it around right now. Joe Burrow's playing great.
Yes.
I would err on the side of playing him, but obviously just hoping that back doesn't get re-aggravated early in the game.
Yeah, so you're giving him what I'm hearing you say is maybe a 50-50. Is that where you're kind of coming from, or do you think he's going to start, but be careful because he might not produce?
Exactly.
Okay.
Exactly. I think he's that one that has a potential big boom side to his numbers if he does play. But again, I would if you can wait till right before the game starts and see how he does, if he warms up, and then switch him if you need to.
Yeah. It's interesting. You're exactly right. I noticed the other night watching them on Monday Night Football, Cincinnati Bengals, they're coming into their own. They're starting to catch their wind, so to speak. They have T. Higgins, and they have some really good, speaking of tight ends, their tight ends were highly productive on Monday night. And Jamar, I think he's actually expressed some concerns that he's not getting the ball. So I think they're trying to get it to him too, right? Because he is pretty dynamic. So keep an eye on Jamar Chase. Watch him warm up, and then you can decide whether or not you want to start or sit. Kyler Murray, QB, Arizona Cardinals, finally making it back from an ACL tear. Here it is, Week 10. I think he suffered his injury December 12th of 2023. So what is that, December? We're almost looking at 10 months here, at least 11 months, his return. Why so long? And you think he's going to be back?
Yeah, I think, you're seeing that the definite trend nowadays that most of these skill position players are almost going a full calendar year and coming back from an ACL. And some of that is statistical outcomes showing that just the re-injury rates, even if somebody looks fantastic, the re-injury rates are higher in the first 12 months if you return to play. And so these guys they're an investment for the team. And so they, I think they're thinking this guy might be trade bait to go someplace else. So I think they would have probably kept him out if they were had another alternative. But I think now they're going to try to play him. Hopefully he is productive, and then they can, probably draft somebody new this year and trade him if he does well the rest of the year for something else. So he'll be a play. But I think there's two things that go into it, Shannon. Like one is obviously what you deal with on a regular basis as a therapist. And that's the, functionally the strength, the flexibility, the balance, all those things that you can get that. And then there's some of the things we can't always measure, which is what's the biology of the actual graft itself.
Yes.
How does it heal? How does the blood supply come back into it? And kind of not being able to really understand that. It's not like you can open somebody's knee up and test how strong that ligament is and sort of say it's reached 100% or it's still only at 80%.
Yeah, it's an amazing surgery. It's come a long way since I've been in this business for about 35 years. I mean, when I first started in this business, an ACL was a Macintosh procedure. It was a huge surgery. You remember these days probably. And I think the patient came out and it was a long leg cast. It was almost like a cast. I mean, they were immobilized for several weeks, and the rehab was long and tedious, and now it's all kind of minimally invasive surgeries, the technology, the techniques, and it's not unusual to come back, but it does come back in 12 months, but it does take that long for engraftment, the muscles to catch up. You have to remember these athletes are cutting and twisting and turning at a high speed, and that muscle has to be able to fire. But, it's interesting for our listeners. I want to really have them understand when you talk about engraftment, think about you're taking a piece of tissue from the body and then you're putting it in where the old ACL was that is now torn, and the blood vessels have to get in there and supply blood flow to that new graft, and that graft is going to be healthy with good blood flow. And that takes time, right? There's so many weeks that takes to happen. Can you talk about that engraftment?
Yeah, exactly. A lot of it's based on, studies in animal models where they can kind of look at how healing happens over time. But, it's sort of analogous to putting a new plant into a pot with new soil and sort of, what amount of time does it take for the tendon bone interface to become solid? And then once that happens, there's new blood vessel growth that kind of goes in and around the graft tissue itself and essentially allows for our bodies constantly remodeling tissue all the time. And so a new graft is just like that. It's not an inert object. The old grafts that were done, some of the Gore-Tex procedures and stuff like that were around for a little while, they were super stable, but they just broke eventually because you don't have the compliance of that tissue long term.
Yeah, I remember when I was in undergrad college at Washington State University, one of the orthopedic surgeons in town, in Pullman, Washington, it was like very novel because he just implanted the first Gore-Tex graft. This was probably back in probably 1982. And they don't even use them anymore, but that was like the latest and greatest at Gore-Tex. Everybody was in awe, but it did not work. The best tissue is your own tissue and that engraftment process. But a lot of technology, a lot of advancements in ACL reconstruction. Speaking of ACL reconstruction, man, I feel bad for this guy. I really feel bad for this guy, Daniel Jones. He was out for like 3 weeks with a neck injury, returned New York Giants, and on his return, he tears his ACL. This is a season-ending thing. He's technically done.
Yeah, we've kind of had that sort of bad luck discussion for a lot of guys.
Yeah.
He just seems to always have something happen. The minute he seems to get in control of things and maybe look like he's turning the corner, his body gives out on him. So his was a low energy injury. He actually tried to come back in and play. They checked him out in the tent and cleared him to return. So they clearly didn't feel like it was a grossly unstable knee, but then he went back in and just took a step and felt to give out on him again. And so, he's going to be, undergoing that ligament reconstruction. He'll be out a year and, he won't be coming back. We just talked the 12 months. So, we're talking December of next year. Will he be able to come back, and what's his role going to be? He signed a big contract, so he's going to be hard to move on from because they invested a lot in him.
Yeah. Well, there you go, folks. There's our Start or Sit podcast going into week number 10 in the NFL season. Dr. Hawkins, I have to ask you real quick. You grew up, if I remember right, and were born and raised in Philadelphia. Is that correct?
I was not. My wife was, but I lived outside of Philly for 20 years. Yeah.
Okay. Well, then I have to ask you, because this weekend we have a big college football game at Happy Valley, I think it's called, at Penn State. They put 110,000 people in that stadium. You ever been to one of those games?
I have. It's actually pretty spectacular. I've been to one of the night whiteout games. It's pretty amazing. That place rocks. It's a very old stadium underneath it. I mean, it's got, exposed steel girders and down to basically gravel around the underside. So when you're inside of it, it's like they took the biggest high school stadium and supersized it. Yeah. So the whole place moves when it's full.
Yeah, that's cool. They play Michigan. Penn State plays Michigan this weekend. Where'd you do your undergrad again? Where'd you go to undergrad?
Oh, I went to Georgetown, so I'm a basketball player.
Oh, yeah, of course you are. Of course, Patrick Ewing was probably there when you were around. But who do you have? I mean, just with your Philadelphia, your Pennsylvania roots, Penn State. You got Penn State going to upset Michigan? What do you think?
Yeah, they always put up a good fight, but I think what you're going to see, I mean, Michigan's a great team, and I think with all the controversy that's going on right now, I think that those players are going to, really tighten up and play outstanding to try to support their quarterback, Harbaugh.
Yeah.
And so I think, Penn State will play them tight, but Penn State's quarterback has not been very productive this year. He's a little bit of a dink and dunk kind of guy.
Yeah.
He's only had like 10 throws over 20 yards for the season, completions. And so they don't have the ability to keep up with a high-powered team. So if they get behind, if their defense cannot keep Michigan low scoring, then they're probably going to lose badly.
If you ever need a second career and you want to retire from orthopedic surgery and do something different, you would be a really good play-by-play color analyst. I think you're really good at this. I'm going to give Penn State the win at home for a college upset Saturday, just because it's not just a whiteout. They're calling it a stripe out. One section's white, one section's blue. That's intimidating. Okay, no, I'm just kidding.
It is. It's a cool environment. It really is.
Yeah, I'm going to watch the game.
Out there.
Definitely going to watch the game. Dr. Hawkins, once again, like always, thank you for your time. Thank you for your expertise. Thank you for your analysis, and look forward to seeing you for Week 11 next week. So have a great weekend. Enjoy yourself, everybody out there. Good luck in your fantasy football. And I got to leave you with a Go Cougs. I just have to. They're kind of struggling, so I got to give them a shout out. Okay? All right?
Sounds great, Shannon.
Okay. See ya.